Hi, my name is Wael El-Dalami. I am Professor and Division Chief of Global Health at the University of California, San Diego. I'm here today to talk to you about e-cigarettes, which are also known as electronic cigarettes, or the act of smoking it is called vaping. And these are different from the conventional cigarettes, the combustion cigarettes, in that they deliver mostly nicotine with glycol and some other components that are definitely less harmful than that generated by combustion cigarettes or the conventional cigarette that uses tobacco. The use of e-cigarettes has been very much debated in the public as well as in our professional public health societies and community. The reason for this debate is that it is not well known if the e-cigarettes will help smokers who are actively smoking to quit and switch to e-cigarettes, which are less harmful, or if these e-cigarettes are being introduced to new population who are non-smokers and never smoked in the past and are likely going to be addicted to nicotine from e-cigarettes and then use the normal conventional cigarettes and become addicted to that. And the data so far has been produced mostly from controlled experimental settings, and they have shown some influence of e-cigarettes on quitting habit, positively helping smokers to quit. However, in the population, there are limited studies and not as conclusive. So we embarked on a study in California where we followed up 1,000 active smokers for 1 year. And we asked them questions at the beginning when we started the study if they have ever used e-cigarettes. And we followed them after 1 year and asked about their smoking behavior and if they had quit, decreased their number of cigarettes that they smoke, or they have made quit attempts. All are indicators, positive indicators of quitting behavior. We also asked at the beginning of any other factor that are usually related to quitting, such as level of addiction, intention to quit, how much they smoke, and these factors and demographics that could influence the findings. So we adjusted for that, so we are specifically trying to pinpoint to the influence of e-cigarettes. This is a population-based study, and so this is a normal behavior of people who are smokers in the population, which is unlike those in intervention studies where people are volunteers or they are expected to behave in the way that the intervention is required from them. What we found is that the smokers who have ever used e-cigarettes in the past were significantly less likely to not be quit after 1 year. That means those who were using the e-cigarettes for whatever reason were actually becoming more addicted or less likely to be able to quit from this behavior. And we also found that they were less likely to decrease the consumption of cigarettes, although they were trying to quit. So their trial to quit, as we asked them, was not significantly different among the past users of e-cigarettes and the non-users, but the decreased likelihood of quitting, the less likelihood of decreasing consumption of cigarettes were significantly, statistically significantly much different from those who never used e-cigarettes. So that gave us the conclusion that the users of cigarettes in the past were less likely to be quit or decrease cigarettes after 1 year, which really provides us a cautionary data input on using and propagating e-cigarettes. It might be working for some in experimental design or in some of the anecdotal evidence of individuals or small studies, but in the population, the e-cigarettes are not, the e-cigarette users are not likely to be able to quit or decrease consumption. So, on the other hand, many large studies have shown that the young and the youth, people who are never smokers, are very much likely to use e-cigarettes. So there is a risk that the e-cigarettes might introduce such people, such young people, into actually becoming addicted to nicotine and maybe also using the conventional cigarettes. So that study is important addition to the literature, and further studies are needed to confirm such a finding and therefore hopefully pass some regulation regarding the use of e-cigarettes before they become taken over by youth who otherwise would not have smoked or used nicotine. Thank you.